me reintroduce Reggie, who we've already heard from. So Reggie is going to talk now about setting up a multidisciplinary clinic in Montreal at the Shriners. So Reggie, you could share screen. Thank you.
Thanks again, Sanjeev. So this talk that's our multidisciplinary clinic in OI, osteogenesis imperfecta, our best multidisciplinary clinic. I have no disclosure. So what we'll go through in the next few minutes, what is really the definition of a multidisciplinary clinic, the difference between multi and interdisciplinary, the advantages, how to set up a multidisciplinary clinic, what are the criteria, the organization of the clinic, and if is a multidisciplinary in general recommended for every pathology. Is it difficult to create an MDC in low resource area? The next two speakers will speak about this. What I'm going to say here really applies to any area or any country in the world. And I just want to mention, as Mangal Parihar mentioned in a beautiful talk, is that really the most important part in an MDC, it's the human resources. You don't need sophisticated equipment. You don't need sophisticated implants. It's really the human factors that is needed. So that's almost everyone agrees that a multidisciplinary clinic provides a forum for clinicians and healthcare professionals of different disciplines to evaluate and discuss patient care in real interaction. And the next two slides will really stress on this, with the full participation of the patient and the family. If you don't have the participation of really the family and the patient, it's not a true multidisciplinary clinic. I took this from the internet, and I think it's a beautiful slide. If there is no interaction between the different disciplines, then it's not a true multidisciplinary clinic. You have to have this interaction between all the disciplines. If you don't have one, you can be seen by 100 specialists, but if they don't talk to each other, it's like going to a shopping mall. This means that, yes, you will have everything, but there is really no interaction. And I like to make some quotations all my talk. As Steve Jobs said, great things in business are never done by one person. It's a team work. And again, that's the message, the theme of this webinar. The benefits of having multidisciplinary clinic are numerous. You concentrate all the expertise in a specific area. You bring standardization and consistency. It's very, very important. Provide the best care, and that has been shown by not only patient-reported outcome, but in numerous studies. Accountability, very important. We'll come back to this. You have the commitment. It improves efficiency and it decreases cost. Maybe most people will not think the same thing. And then it's enhanced trainee education, increases the visibility for all these things. It attracts patients and referral, recruitment, donations, fundings, encourages partnership, clinical trial enrollment becomes easier. And we keep saying this all the time here. It encourages a shared decision-making with the patient. If you want to know more how to create a multidisciplinary clinic, I strongly suggest these two articles, specifically this one, Creating a Multidisciplinary Clinic. It's a chapter in a book. It's probably the best publication that I have seen. We go now to the meat of this presentation. Before setting a multidisciplinary clinic, there are certain criteria that you have to have. 5 of these criteria, it's what I call absolute criteria or prerequisite. And if you don't have them, then there is no way you will be successful in establishing the clinic. The first thing is obvious, but you must have an adequate caseloads of patients. Without these, really, there is no point in starting a multidisciplinary clinic. If you are going to see one case of fibular hemimyelia a year, you cannot ask to have a multidisciplinary clinic. And this mix can be of everything, like congenital pseudoarthrosis of the tibia, skeletal dysplasia, infections, but the mix of all this will give you enough caseload. Second thing, you need a leader that is passionate, advocates for the clinical and the patient, support everyone, knows how to lobby, knows how to fight. And that's, I'm very, like I repeated, knows how to fight because the resources are limited, even in the most advanced countries. You need a dedicated leader who can say, who can admit that, oh, I cannot advance. Okay, who can say, I cannot control the winds, but I can control the sails. And it applies 100%. The next theme, and that was mentioned by everyone, you cannot alone do a multidisciplinary clinic. You need a dedicated, motivated, committed team that helps you. Another thing that it's very, very crucial for all of us who work in hospital, you need the support from the administration because they are going to provide the human resources, the infrastructure like the space for the conference room, the funding, telemedicine, the marketing. You have to be online and you have to have that support. Something that I was encouraged from the very beginning that I should show accountability to them. And you need special communication skills to really to communicate with the leadership administration. From the start, I was advised to have a small committee with few members, meet on a regular basis, prepare regular reports regarding the performance indicators of the clinic, and present measurable outcomes. You need to do this if you want to have a continuous support. Another thing that I found, in fact, not only me, but almost everyone, you need a nurse coordinator or a nurse practitioner really to be the leader in that clinic. She coordinates everything with the patients and the physician. She's the pivotal point where everything hinges. Without a dedicated nurse practitioner, good luck. So once you have completed these 5 requisite criteria, the next is to prepare a business plan or a working document, whatever you want to call it, but it's a description in detail of how you are going to see the clinic. It's many, many things. I will go through them very quickly. You have to demonstrate to the hospital leadership your commitment, the financial viability, and the benefits to the patient and the institution. You have to have a vision and clear goals and objectives. I will come with the organizational structure in 1 second. And that's, I've already mentioned it. You need indicators of the performance. And you have to have a committee where you can be accountable and includes all the rest. The last one here, engagement of the community and the families. The organization of the clinic, it was just mentioned, it can only be done in a multidisciplinary clinic where you have all these really subspecialties. At the end, you need to make this shared decision-making with the families and with the patient. And I put here on the top of all these things, it's the nurse practitioner or the coordinator. You need this if you want a successful multidisciplinary clinic. The organization of the clinic, which is the timeline. So whatever timeline you want to have, it differs from one clinic to another one, but the team has to meet before the clinic. Usually here, for example, I'm taking this, which is one of our clinics. We meet 1 week before, the Wednesday before the clinic. We go through all the patients that we are going to see. The nurse practitioner and the nurse coordinator, they coordinate all the patient's schedule with the various specialists. Ideally, the patient comes and during 1 day, they see all the specialists and ideally should be in the same place. During the clinic, the various specialists talk to each other. For limb lengthening deformity, it will be 1 surgeon. We have 2 surgeons here. We talk to each other. The PT is here, the OT is here, the orthotist is here, the NP is here, social worker is here, and all of us, we talk. After clinic, we discuss what's the final plan with the family, and before the patient leaves, the patient and the family have what is the final outcome and has the final treatment so that they know where they are going. take-home message, the multidisciplinary, it's not for everyone. It's not for every institution and not for every pathology. However, if it's indicated, they are the best way to present and to provide the best care. Careful planning for the creation of the clinic is crucial. If you do a bad planning and from the very beginning it fails, you are done. Interdisciplinary care is extremely important, and there is no difference in low resource or high resource. You can establish the MDC clinic. It's really, as was beautifully mentioned again by Mangal at the beginning, it depends on the human resources and specifically the nurse practitioner. If you need any help with this, we have established many clinics here. And I will finish on one quote from Mother Teresa. I love it. I can do things you cannot, you can do things I cannot, together we can do great things, which is really emphasizes the team. Thank you.